Hi, everyone. So, welcome to a topic of self-care and supervision. So, self-care is going to be defined as practices that kind of help deal with the stress and even difficulties and professional concerns that come with being in the mental health field. And then supervision is a formal kind of intervention where supervisees or younger professionals work with someone who's in the field a little longer to get some guidance and help them grow in a kind of a formal relationship to help the new professional develop and mature in the field. So with that, let's focus on some key themes. So it's important as mental health providers that we pay attention to our own physical and mental health because that's going to be able to help support and assist the consumers or individuals who see us for mental health services. So the big thing to remember is in the mental health field, we, the provider, we are the tool. So it's different than, let's say, surgery, where the surgeon is using a scalpel or other sharp tools to implement kind of some sort of change in the body, whether it's repairing a muscle or even removing something from the physical person. But again, the tools that we use come from us. We are very embodied and we use our personhood to help someone grow and deal with their situations. So just like a painter would make meticulous care of their supplies, same with a surgeon, same with anyone who uses tools such as a carpenter. They have to take care of what they use. Therefore, we use ourselves, so we have to take care of ourselves. So, just the nature of the mental health field, it is very common to experience chronic stress, burnout, and vicarious trauma. I'm going to mention more about this as we continue through these slides. So, these are just potential hazards of working in the mental health field. That is just the nature of inherently what we do. We spend most of our days talking with individuals who are in very low points of their life, who have experienced a lot of darkness, trauma, stories that can be very uncomfortable to hear. And yes, there is a positive where we can see people grow and overcome a lot of obstacles. There's also a time when we're seeing people at their lowest, and no doubt that can create kind of stressful feelings. In addition to this, too, the mental health field from an institutional level has a lot of issues. A lot of therapists are overworked. Billing becomes quite of an issue. There's a high demand for services, but there's never enough clinicians. There can be a lot of infrastructure elements that can add to burnout and stress as well. So therefore, to mitigate all this, self-care can be very beneficial. And self-care is designed essentially as activities to recharge, reinvigorate, and be proactive. And that's going to be the key. We have self-care works best when we're proactively and consistently utilizing it. And because that can help prevent chronic stress and then impairment. Another component is clinical supervision, and that's a place designed to essentially receive support, continue our education as mental health professionals, and as a resource to help us grow not only professionally, but also personally as well. So, stress is a big component in the mental health field. Not only as providers are we helping our clients slash consumers deal with the chronic stress or the impacts of stress, but again, the nature of the work can be stressful. So I want to take some time talking about the makeup of stress. So stress is both a biological and psychological process. So first, we have a physical sensation in our body, such as increase in heart rate, maybe some tension in our shoulders, sweaty palms, shortness of breath, dry mouth, etc. And then that is followed by a mental process that labels that sensation as feeling stressed. So, psychologically, when we look at that component, we can break down stressful thoughts typically revolving around something from the past or the future. So, what's missing in the pseudo math equation is the present. So therefore, we can reduce stress by focusing on the present moment. So taking, whether it be mindfulness activities, meditations, doing something that you enjoy where you can enter a flow state, anything where we can take a moment to really be in the here and now can help reduce stress levels. And that's going to be key because stress can kind of build up. And again, short-term stress, well, also known as acute stress, that's normal. That can also be beneficial. Sometimes in those acute stress moments, that's where we learn the most. So short-term, that's just part of being human. You're going to have moments of acute stress. It's a normal experience. However, when that acute stress becomes a more long-term element, then we have what we call chronic stress. And that can cause not only physical damage, but also impact our mental well-being. So possible signs of chronic stress, and again, this is not limited to this list. There can be many more, and it can be individually specific, but it's not uncommon to have someone have headaches, especially tension headaches, feeling very drained, low energy, fatigue, definitely changes in sleep patterns. There's just something about the human psyche where that kind of shift from the daytime to laying in bed seems when all the stress monsters come out and play. There is something weird about that, but that can definitely impact our sleep issues. We can have digestive problems, and there can be aches, pains, and muscle tensions. So we have chronic stress, and then kind of the next level of this is burnout. So again, we go from acute, stress is kind of a normal experience. Those normal experiences are coming more and more common, and those common chronic stress that we haven't dealt with or hasn't gone away can lead to burnout. So the burnout is the result of prolonged chronic stress in a work environment. It is not unique to mental health providers. We see this in high stress jobs such as healthcare workers, police officers, military, on and on and on. But again, it's not unique to mental health fields. It is prevalent in mental health fields, just like other healthcare fields as well. So signs of burnout can include changes in personality. Maybe you're a very optimistic person, now you're feeling very pessimistic. Maybe you've been very social, now you're withdrawing from people. Maybe you've been very motivated to take care of your health, and now you've kind of let that slip. We can also see alienating from work-related activities, showing up later than usual, not completing proper documentation or other paperwork on time, not attending meetings or continuing education, and just kind of disengaged from work. We could also have physical symptoms. Again, it's going to be similar to chronic stress. We can have emotional exhaustion as well as compassion fatigue. And compassion fatigue is essentially, or it can be many different things depending on the person, but the way I kind of define compassion fatigue is you're hearing people tell these horrific stories and even stories of resilience, and you just don't care anymore, to the point where you're like, I cannot hear another story about blank. I just can't do it anymore, or I can't listen to this person talk anymore. There can be a sense of compassion fatigue. I am tired of being empathetic. I am tired of caring. And as well, this will reduce work performance. So again, burnout is a high possibility in mental health care settings. This may sound hyperbolic, but it's safe to say once someone's been in the field for a certain amount of years, they have experienced times of burnout. Burnout is a very discouraging feeling. This is something, from my own experience with burnout, it made me question whether or not my life's work was worth it. There's times when I know I'm feeling burnt out. It's when I'm looking to completely leave the field and really just have a very dark, gloomy sense of the human experience. It's not positive. It's a very tumultuous feeling. And that's why I want to do our best to kind of help not only ourselves, but our clients as well as colleagues to prevent from entering the burnout phase. So here's the risk factors. Again, a lot of these, as we'll see, there's a lot of institutional elements that can come into burnout. That's why having awareness of burnout can help us kind of navigate ways to prevent it. So heavy workloads. So what we mean by this, seeing a high caseloads. So that could be, seeing 40 people a week with a large amount of paperwork and then plus other job responsibilities. So working at a college counseling center, that's what I used to do prior to having my own practice. there were certain times of the year where I was seeing probably 40 plus people a week, working more than 12 hours a day, 5 days a week, and just feeling really burnt out to the point too where having that high caseload and high demand, I had to come on the weekends to finish paperwork and prepare for the next week. So there was no break. In addition to this, there was a time period we were short staffed. So there was more job responsibilities as well. So when you have heavy workloads, not enough time to complete work, feeling unsupported by peers and management, and then having to have multiple roles and hats can really feel overburdening. Also, too, we could, excuse me, those points, ideally we can create organizational change and support through advocacy, as well as having other allies to advocate for to places of that have power to maybe change some policies and procedures of the institution, add more support, make some modifications how services are provided, etc. There's hope we can deal with those situations. The last PowerPoint, unfortunately, is kind of inherent to the mental health field. There's going to be times we have difficult and unrewarding situations. Difficultness is just the nature of the work. Again, we're dealing with individuals who've had experiences that can be highly difficult. There can be patterns of just relational elements that make the therapy process really straining and stressful. In addition to this as well, there are many times that our work can feel unrewarding. Not all the time. There's these beautiful moments that make us really feel that what we're doing is beneficial. But another component too, a lot of times we don't see how much impact we had on clients. And so that's sometimes we have to find ways to recognize the unrewardingness that is prevalent sometimes in our profession. So, other words, one step that has been helpful for me, especially when I was at a college counseling center, we had in our supervisor at the time had a culture where if you had a win, that's what we called a win, so a positive, rewarding situation, whether you saw a difficult client kind of overcome their barriers, you had a positive experience, whatever it was, you were encouraged to share that win in our weekly meetings. And it never felt egotistical, it never felt showing off, but we were encouraged to share those wins because that allowed us to feel rewarded. That gave us momentum to come on. And when a win came, it was very rewarding, to share it. You hear that kind of strategy quite a bit. Some clinicians keep a notebook or a note card or some sort of box where they have rewarding elements that they'll store. And then times when they're feeling kind of a difficult time in their life or just questioning things, they can go back to their rewarding box and see, all right, what I'm doing does make a difference. So in those moments can be very, very motivating and empowering, but we need to foster them from our own clinical experience because again, just sometimes the nature of the work, we may not see the impact that we've had in our clients' lives. So the next component, again, this is common in the mental health field, also known as vicarious trauma. So as mental health providers, we are most likely going to be working with individuals who have experienced traumatic events. That's almost a given. Depending on certain settings, is almost a given that you will experience this. So again, with college mental health fields or college counseling centers, there was a time where trauma was not very prevalent. At least that's what the reports would say. But that has greatly changed. Where when we used to keep stats, trauma was a pretty common. Not everyone experienced or reported, but it was a common event that many of us had on our caseloads. So, with that being said, vicarious trauma is the phenomenon where the provider, so mental health therapist, becomes negatively impacted due to hearing traumatic stories. Again, if we're working 12 hours a day, seeing 12 clients a day, 5 days a week, those stories can build up upon us. So the thing to remember with vicarious trauma, it can occur much quicker than burnout or chronic stress. This could occur from one session, depending on our own history and makeup, as well as what the person's presenting in front of us. So signs of vicarious trauma can include increased arousal, hypervigilance, emotional activation, emotions that we feel are stronger than usual or kind of out of our control, intrusive thoughts related to traumatic stories, and avoiding thinking of working with consumers. So this idea of, well, that's it, I'm done, let me find other jobs component. In addition to that too, there can be physical symptoms of vicarious trauma. So for example, for me, again, I don't know how true this is, but for me personally, I have a sense that I may be feeling vicarious trauma when my eyes start twitching. It's a rare experience, but I've heard this also from other counselors as well. Sometimes there's body tics that feels like, all right, I may be experiencing some vicarious trauma here. That could be a sign that I have to process this in supervision or really emphasize self-care activities that's going to help me express what I've just have felt. So with that too, I really want to be clear that burnout and vicarious trauma and chronic stress can have this sense of shame in the mental health field if you experience this, and that can prevent especially younger clinicians who are new to the field of opening up about what they're experiencing. It's like anything, we're taught in graduate school a lot of times that, hey, don't burn out, don't do this, don't do that. It almost creates this idea, if you do experience this, there's maybe this message that you're weak. And that's not true at all. Again, like I mentioned earlier, at a certain point, almost every therapist I can think of that I've known has experienced burnout or vicarious trauma at some level. It is just kind of part of the work. And so, therefore, why I'm really emphasizing on that is one way to really help from my own personal experiences, talking to other clinicians about what you're experiencing, getting a sense of support, as well as hearing their stories of how they overcame it can be really hopeful and really inspiring. So if you are noticing these signs, it's definitely easier to be more proactive, getting support earlier. And also, don't feel like you have to keep this secret to yourself, right? There can be a lot of shame, but again, most of us has experienced this at some level at some point. So to really reemphasize what I just said, working in the mental health field is stressful. Therefore, taking care of ourselves is going to be the key to a long and successful career. So now we're going to shift into self-care. So the big thing is be proactive with stress, right? We want to be preventative rather than reactive. And so what can be helpful is knowing what stresses you out and what is your baseline stress, okay? So if you know what your baseline stress is, then you can be aware of when you're feeling overstressed. So again, stress is a normal experience. So know when you're feeling just that normal stress to more chronic stress. So be aware of situations that increases your stress. It's good to know those triggers. And also understand too, there's going to be times we can avoid stress, and there's also going to be times we cannot avoid stress. So if we can avoid stress, great, let's avoid it. If we can't avoid stress, then let's develop some sort of plan on how we're going to manage that stress. So if we develop and practice various coping strategies, and again, the idea is various because we don't want rigid coping skills. If we only have one rigid coping skill, it's not going to be as effective. We want various forms of stress management and activities because there's going to be times we may not be able to utilize them. So for example, one of my strong stress management activities is using oil pastels to draw. But there is times I can't do that, so I must find more accessible stress management techniques, whether it's focusing on a rock, doing some breathing activities that can only, don't have to take so long. And those elements can help manage stress. And then when I have time, I can utilize more effective skills. So again, it's better to be proactive rather than reactive. So some common self-care strategies can include physical exercise. So the big thing with physical exercise is we want to be in the moment when engaging in these exercises. So you hear this from clients and other professionals all the time. Well, I went to the gym, but it didn't work because I kept thinking about the stress. So again, if we went back to the previous slides, where stress, especially from a psychological level, is concern or focus on the past or the future, then if we're engaging in self-care strategies, we want to be in the moment. So exercise is great, and we really want to make sure that we're being in the moment rather than on the past or the future when using that physical exercise. Eating a balanced diet and times stress is not uncommon for people to overeat and high comfort foods. This is definitely me. When I'm feeling overstressed, that's kind of my habitual pattern. So I have to be practicing mindful eating and be aware of that. Proper sleep. So with sleep, some strategies to include: only go to bed when you're tired. Get out of bed. So if you're laying in bed and you start to have those racing thought monsters come in at night, then it can be helpful to get out of bed and move to another location and then return to bed when you're feeling tired again. So only use bed for sleep and sex. Do not eat in bed, watch TV in bed, or complete homework in bed. Make bed a ritual for only a few activities. That's going to make it easier for you to get in that mindset of sleeping. It's almost like behavioral conditioning. Another component is avoid self-medication. This is rampant in a lot of healthcare fields, as a lot of people deal with chronic stress using self-medications. The thing is, self-medications work. That's why people use them. They temporarily reduce the sensation of stress. But why they can become problematic is it doesn't do anything that causes the stress, right? So you can have a reduction in those sensations, but your thoughts may be focusing on the past or future, or you haven't changed the circumstances which causes stress, which means you have to increase your self-medication and increase the frequency, maybe even the amount, which again can cause more issues, which can increase stress. Hopefully you see how it's kind of a pile-on effect. So we want to avoid self-medication. Also, time management. We want to find time to recharge ourselves through activities that promote relaxation and a sense of enjoyment. So remember, the biggest thing about self-care is the best strategy is the one that works for you. So now we're going to shift on clinical supervision. So what is clinical supervision? Well, clinical supervision consists of a relationship between a designated supervisor and a supervisee. Could be designated through the agency, could be designated through some sort of association, like maybe the Play Therapy Association for Play Therapy, or it could be designated by the state where your license is. So the supervisor and supervisee typically meet on a weekly basis, again, depending on the setting and the state, and as well as the license or mental health profession. That's going to vary, but typically, let's say it's meeting on a weekly basis, and it's with the purpose of fostering the supervisee's growth as a mental health professional. So the role of the supervisee is to be prepared to discuss work-related events, openness to growth and feedback, take responsibility for their own behavior, and actively participate in supervision, including relevant work in between meetings. So there's many different models of supervision. A common one that's taught in a lot of counselor education programs, counselor education and supervision programs, is the discrimination model. So the discrimination model allows the supervisor to play 3 roles throughout a supervision session. The first role is going to be seen as a teacher. And again, depending on what's happening, the supervisor is going to change their role that they're playing. So the teacher role is the supervisor can instruct, directly lecture, and inform the supervisee on a specific topic. Or so let's say you have a supervisor who is trained in EMDR and you would like to learn more about that supervisor can provide that information on a teaching level. We also have the counselor role. So there are times when the supervisor will use a therapeutic role to help the supervisee address blind spots and concerns that are directly impacting professional work. So remember, supervision is not counseling. There's times a supervisor will use counseling modalities for modeling or to explore more in depth the possible personal elements that are impacting the work. There's going to be times, though, when the supervisor will discuss the possibility that the supervisee participates in formal therapy sessions with an outside provider. Because again, there's a fine line between using a counseling role and then entering the role of a counseling session. So when the supervisor feels like, all right, this may get more into counseling sessions are needed, there'll be a discussion of, hey, this professional issue is really being impacted by these personal issues that probably need more time and support to address. So then that way it's probably going to be beneficial or recommended to see an outside provider. The other component is consultant. The supervisor takes a more collaborative approach and is seen as a colleague who is offering support and guidance. So from a supervisor standpoint, there's a lot of experience as well as training that's needed to utilize this model, especially to know what role to use and when the situation is becoming where it is getting past supervision and is entering more counseling. So remember, in order to help others, we must be able to help ourselves. So if we're not functioning, it will be difficult to help other functions. So that's why self-care, being aware of burnout, vicarious trauma, and chronic stress, and getting certain supports, such as clinical supervision, can help us be the best helper possible to our clients. So again, you hear this a lot in the mental health field of the analogy of oxygen mask on airplanes. So the rule is, like on an airplane, if the oxygen masks are needed, you must put on the mask first before assisting others. So in order for me to help others, I must help myself. It can sound selfish on the outside, but again, I am the tool that is used therapeutically. My sense of self, my sense of personhood is influencing the therapy process. If I'm not functioning properly, the therapy process may not function properly, and then my client is not going to get the best services possible. Therefore, I have to take care of myself. So, again, working in the mental health field, it is stressful. Therefore, it is okay to ask for help. You're not alone, and support is available. That's the biggest message I want you to take away from this PowerPoint is many of us have been there before. Please don't feel ashamed or feel like you have to keep this to yourself. Talk with colleagues, talk to people you trust. They probably have experienced it as well. Again, you're not alone. Support is available. Here's the references. I'm going to stop the screen. Thank you and have a good day.